The year's 1978. You're playing a sport, you sprain your ankle. Fortunately, Gabe Merkin, MD, just came out with the RICE protocol. Rest, ice, compression, elevation, which is how you manage an injury after you initially hurt it. People are still talking about it today. However, watch this video and I'm going to show you why that's, for the most part, all wrong and what you should do instead. Something shocking happened in 2015 by Dr. Gabe Merkin himself. Dr. Gabe Merkin, the same physician who coined the phrase RICE in 1978, came out and said he was all wrong. I have a link for the article in my video description. Check it out. Over the last decade, the RICE protocol has evolved, starting with PRICE, or protection, rest, ice, compression, elevation, and then later to POLICE, or protection, optimal loading, ice, compression, elevation. In 2020, an article published by the British Journal of Sports Medicine suggested it was time to get rid of RICE and replace it with peace and love. This brings us to today and the most effective protocols to rehabilitate after you do get injured. So you're out walking the dog, you roll your ankle, everybody runs home and rushes for ice. But we want to really look at, in the acute phase, or those first 48 to 72 hours, that's when the inflammatory phase of an injury happens. We want to look at peace, protection, elevation, avoid anti-inflammatories, compression, and elevation. We'll talk more about each of those, but once you get into the subacute phase, or after those first few days, that's when you start to look at love. It's critical that you have loading, optimism, vascularization, and education through the recovery process. You'll probably notice something that's missing from both peace and love is the letter I, no ice. You're using ice just for pain relief. All of the studies to date show that for you to be able to reduce inflammation, you're gonna have to get the tissue so cold that most people wouldn't be able to tolerate it, number one. And number two, we want circulation to a tissue that was just injured. We want the inflammation, we want the inflammatory process because it's bringing all sorts of chemicals to help start off the recovery process. And if we reduce it or eliminate it and block it like we do with an anti-inflammatory drug, then we're going to cause delayed healing and a longer time till you get back on the field. Let's look at each stage of the peace and love and explain what that would look like for that typical ankle sprain. Now, of course, this would apply to any injury, and how you're going to go through each phase will vary slightly based on that tissue, but we're gonna use a simple ankle sprain that everybody's familiar with. P, protection. When we protect that ankle, all that means is we're gonna immobilize it for that first few days, 24, 48, 72 hours at most. We're gonna try to keep that from having any more injury to it. So that could be bracing, that could be taping, that could be wearing a high top shoe and tying it really tight, but we wanna make sure that there's no further damage done. Next is the elevation. That will help your body use gravity to naturally get the inflammation out of the area once it's done doing what it needs to do. So like we said, the inflammation needs to come to the site. It needs to come and begin to repair, bring the raw materials to help with recovery. And then once it's done doing what it needs to do, that fluid needs to leave. If our foot is hanging down all the time, that tissue is going to be full of inflammation and it's going to be difficult for the new inflammation to come to do its job. So hopefully that makes sense. What we're really trying to do is just get rid of congestion. We don't want congestion in the injury site. We want the stuff to come, the cleanup crew to come. They fix what they need to fix. They deliver the materials they need to deliver, and then they get out of Dodge. When we have poor vascularity, when you're maybe not as healthy and a lot of swelling in your legs at the chronic level, that can impede that fluid return. Okay, so we want it in and out. Elevation can help that. Next, we touched on this already, but avoid anti-inflammatories. If you're a big Advil or a Aleve person, you want to make sure you wait several days before you would even consider using this, if at all. If you really do have a lot of pain and that's why you want to take it, sure, go for the ice. Maybe Tylenol, which is not an anti-inflammatory. You'd have to always check with your physician and see. But the problem is, routinely, if you go to an urgent care, or you go to an ER, or you go to your physician, they will tell you to take an anti-inflammatory medication like Motrin or Advil right after you sprain your ankle. And you're just blocking the inflammatory process that's necessary to maximize your chances of healing. Next up is compression. This could be a little controversial because we want to have that fluid to come in. The compression is going to keep there from being an excess amount. It can help with that tissue being too full of fluid so that inflammatory markers come in and they leave when they're done, and you have some compression. This is more important if you're up and your foot needs to hang down all day long and you don't have the ability to elevate, so you'll use compression and elevation hand in hand. The most important piece of peace and love is education. We need to educate people that they're not going to have an amputation of their foot. You just need to be going through the recovery process, and it's okay to have some discomfort. You need inflammation. We need to start slowly moving, protecting, basically what I just did with you here. That's the education process for peace. Let's move into love. Loading, L. Really, our body's in a constant state of healing itself. There's bone breaking down, it's remodeling all the time, and it does so in response to the load that we put on it. So when we're trying to rehabilitate an injured tissue, we want to load it more. We load by putting weight on it. We load by doing some resistance exercises, gentle stretching. That's all something that may need to be done under the care of a skilled physical therapist. Now, if we move into the next stage of love, this is optimism. Look, most of the time you're going to be fine, and you just need to work through the timeline, which is not very quick for some people. People want to be better yesterday and they get negative and they think that they're going to re-injure it, be worse, and be disabled. Let's remain optimism. These injuries recover. People do well. Oftentimes they forget they even had them. V, vascularization. Here's where we want as much circulation coming into the tissue as possible. This is so that that new healing, say ligament in this case, there's new fibroblasts and things of that nature that are remodeling and trying to mend. We want vascularization in there so the blood vessels can grow in and your body can kind of own that new ligament, that new tissue. Regular movement. Having your legs hanging down without movement, watching TV all day long is not going to help recovery. And then again, E, education. So just like we want to educate our patients, hopefully this educated you. And please, if you're like me and you have kids in sports or you coach sports, make sure you don't go reaching for the ice pack right away next time somebody gets injured. Educate people, stay off the anti-inflammatory drugs, preach peace and love. To watch another video, click up here, subscribe to the channel for more educational content. Click down here.